Okay, thank you.
All right, we can go ahead and get started. The floor is yours, Dr. Aglu.
Fantastic. Good afternoon, everybody, and welcome to our JHM Wiki Virtual Toolkit series with me being Dr. Allison Aglu, who's a PI of the JHM Wiki project. And this toolkit series, the goal is to engage and amplify. But in case you've not been on it, I'm going to ask before housekeeping, can we please mute if you're not speaking, because otherwise we're both speaking. Thank you. So briefly, in terms of our JHM Wiki, if you're not familiar with our collaboration, we represent six, we say, distinguished programs who are dedicated to providing quality and comprehensive, family-centered medical and social support services to Wiki populations, which is the women, infant, children, and youth in our EMA and surrounding areas. The six programs are here, and I'm so excited that some of the representatives of those programs are going to be presenting today. The overarching vision is to achieve a more coordinated response to HIV care by establishing mutually beneficial relationships that increase the quality of care that we provide as a community. The mission is to not to create something new, but sometimes to create something new, but really to build upon existing structures and systems to provide a dedicated network of providers and coordinate our multidisciplinary systems. And again, to engage and amplify. And I really want to highlight our grant funding from HRSA that allows us to do the work that we do. Next slide. As I said, this toolkit series, I think we're 2.5+ years in the running, is our signature series to engage and amplify our experts that are all around us. And if you've had the opportunity to do that, to be a part of it, please definitely check out our virtual toolkit series on the YouTube channel. But today, excited to talk and to have our fabulous group from Sinai present on in support of support groups, particularly now with all that we have going on. And I have three expert individuals that are going to be here. So first is Sarah Raihl. I'd like to say our partner in crime, no crimes, at Sinai. And Sarah is a social worker, clinical social worker, with over 30 years of experience in the field. She graduated with a concentration in family and children's services and really has spent much of her career serving this population. Beginning her work in foster care programs, where she's had the experience of working with HIV positive infants and children during the late 1990s, where, as we know, there were no viable treatments for HIV, and many of these children died. Her experience has been in community-based HIV/AIDS programming, which has inspired her to return to the field and where she is today at Sinai, and has been there for the past 19+ years, where she's been key to the coordination of perinatal HIV prevention, education, and support to over 85 women, infants, and children currently with successful prevention outcomes. She supervises the social work and community health workers in the program. And towards this, she's implemented and spearheaded quality improvement team and members, program development, and contributors, and really rallying all together. She has initiated and developed the wellness program that provides opportunities for her clients to engage in holistic care and management, including yoga, therapy, music therapy, and journaling. And she's been utilizing funding that she has for multiple parts, Part A, Part D, and state special funding at Sinai, and coordinates all of it. We wouldn't be able to do any of what we do with Sinai without Sarah's work. So thank you, Sarah. But with her, I think it's her right hand, Robbin Alexander is a certified community health worker in the Peter Moser Community Initiatives Program, also out of Sinai. Over 25 years, Ms. Alexander is a CHW2 within Sinai and provides leadership within their program through mentorship of other CHWs, as well as participating in their program planning. Ms. Alexander's goal is to help women and youth live healthier lives by making sure they get to and maintain all their medical visits and reducing their barriers to such care. She does this in her non-medical case management work under our Part D work, our Part D program, completing not only community assessments as health fairs and prevention education, but she's an advocate of women's support programming, and she understands critically what role that connectedness and self-acceptance play in the lifelong challenge of living with and thriving with HIV. In the early 2000s, she created a woman-to-woman forum to bring women together to share and support each other. And that program has evolved into a women's monthly support group through our psychosocial programming, as well as annual Women's Wellness Days. Ms. Alexander also helps to coordinate and facilitate their wellness program, including yoga, art, therapy, music therapy, and journaling. With her love of children and families, she's coordinated Sinai's annual Adopt a Family holiday program for the past 12 years. She's also as if she has any more time, is a older woman embracing life, an OWL board member and group facilitator. Last but definitely not least is Sherri Vishner Glazer, who's an LCSW, a clinical social worker with over 14 years of experience. She began her career working in the mental health field at a high school mental health clinical outpatient mental health clinic, and then she obtained her HIV testing and counseling certificate during that time. She came to Sinai at that time and is also working at the Peter Moses Community Initiative's HIV support programs for over 9 years, and has continued to work with women of all ages. As a medical case manager, Ms. Vishner Glazer works under our Part D and as along with Part A programs, providing comprehensive services to youth, men and women, including psychosocial assessments, care planning, and referrals to programs that address the many social determinants of health that impact their patients and clients. She also provides supportive and adherence counseling to her clients to increase their coping skills and work towards their viral load suppression. Ms. Vishner Glazer has an additional role providing group counseling and support. She plays a lead role in their monthly men's support group and their wellness program initiatives. She's helped develop that wellness program over the past 8 years, coordinates, facilitates client activities, which have included movement, music therapy, art, gardening, and more. And she's obtained her supervisory credentialing 3 years ago and is supervising social workers and case managers to follow in her footsteps. I can think of no greater group to highlight and talk about supporting support groups than Sarah, Robbin, and Sherri. Please do take it away.
Well, thank you so much, Allison. That was quite an introduction. We might be done now. I don't know. But thank you all for being here today. This is something that is near and dear to us. And so we're excited to share not our expertise, because I don't feel like there could be an expert when it comes to support groups. We have lots of experience that we'd like to share. So before that, though, I want to talk just a little bit about our programming overall here at Sinai Hospital, our HIV support services. We have had Ryan White funding since the 1980s, late 1980s. We began actually as partners with Hopkins and University of Maryland that long ago. We were all together in a pediatric AIDS demonstration project, and at that time, all of our programming really focused on women, children, infant, and youth. And we still very much focus a lot of our programming there. But in 2010, we did expand our services to include men finally. And we have both social workers and community health workers that provide case management. We also have a small housing grant that provides support to our clients who are experiencing crisis. We have transportation services for our clients to get to medical and other appointments that they need. We have a cost sharing program that provides support to individuals who have copays and deductibles that they're not able to meet, so that is not a barrier to care. And in addition, we have a dietitian, very part-time on staff, who works with our clients to meet their nutritional needs. So that is our overall programming. And so what are we talking about today is support groups. And support groups are really just a place for individuals to come together, a sharing of space. People come with maybe a shared condition, such as HIV in our program. It could be diabetes. It could be just a shared life circumstance, or it could be maybe the diagnosis of a child with a developmental disability or other situation, perhaps postpartum depression. So lots of different support groups happen out in the community. And it's really just a safe place for individuals to come together to have that power of shared experience. And we'll talk a lot today about just the shared experience. Robbin will talk shortly about that, and just how powerful it is to be able to be in a safe and judgment-free place where you're able to share things that are going on in your life, as well as things that you're really struggling with, and to be in a situation where you can get support from others who have that shared experience. There are different kinds of support groups that are out there. Some are peer-led, some are professional-led. Ours generally are professional-led. Both our social workers and our community health workers generally lead the groups. It differs from a group therapy situation where it's really focusing on more of a mental health diagnosis and led as a therapy group. Support groups are much more flexible and able to offer different experiences. And we have at times allowed our clients to come forward and be the leader of a group from time to time, give them the empowerment to have that place where they can share their experience and be the leader for a session. A lot of times, I do want to mention that support groups are a connection from and kind of a bridge from the medical site to getting support services. So if you're coming to a support group as a result of a medical diagnosis, such as HIV, you a lot of times are coming into the same center, same shared space sometimes, same building, same hospital to get that support. And it really is a bridge to making individuals feel more comfortable and safer in that space, whereas they might have a lot of anxiety coming to their medical center for a lot of reasons, including stigma when it comes to HIV. But having that place where they feel safe and they have other experiences in the same setting really provides a sense of relief and it allows individuals to relax a little more when coming into the hospital setting. So we want to acknowledge first and foremost that support groups are hard. That's why we're all here today talking about this subject. I remember way back in graduate school, and when we got to the part about support groups and leading them and other kinds of groups, so many people saying, I'm not doing that. I'm not interested in that because it's a lot of work and it's really, really hard, both for the participants who are coming forward as well as the professionals who are leading. So far as with the participants, really people are coming together and sharing some very intimate details of their life. Whether, again, it's an HIV diagnosis or some other part of their life, they're coming together and they're sharing. And they're sharing things that they may not share with others in their life. And so it's really intense emotional connection and emotional experience, both for the clients and a lot of time for the facilitators. You need to have skilled facilitators when talking about support groups. And nobody starts out as a skilled facilitator. We all start out one day leading our group for the first time. So it's a lot of experience to get someone to the level where they feel like they are comfortable and able to facilitate a group naturally. Lots of things that come into play when we're talking about just leading groups in general. A lot of them just housekeeping. Where are we going to have the group? What's the space going to look like? How do we make the space welcoming? What time of day are we going to have the support group? And how many times do we change that to accommodate and try to get the right people in the room? Do we provide a meal if we're having a group at mealtime? So there's just a lot of housekeeping issues that go into and logistic, as well as just having group dynamics. You often have people where you're moderating and again, they're sharing very intense emotional situations. And so you need to be able to support the person as well as the other people in the room when leading a support group. There's often just lots of different personalities that enter a group. It doesn't matter if they have a shared diagnosis. They could be somebody could be 18 and somebody could be 80 in a room. So you have a wide range of individuals participating in addition to a wide range of comfort levels and personalities that group dynamics are often very hard to navigate. Facilitators need to set up for boundaries, as well as helping individuals get started on sharing, but also not oversharing or monopolizing the time of the group. So a lot of work goes into managing those situations, as well as sometimes there are conflicts within group and being able to have skilled negotiation of conflict resolution. So why do we have support groups if they are so much work? And this is something we may ask ourselves over and over again. But there are so many benefits to having and leading support groups. It far outweighs all the work that goes into it. So there's initially just the shared experiences that can increase an individual's sense of connectedness, of hope, of validation, and being part of a community. Whereas they may not have the ability to share what's going on in their life with many other individuals. They may not feel that their family or friends understand what they're going through. And particularly when you're talking about an HIV diagnosis, a lot of individuals really have a hard time sharing that diagnosis with others and feeling and getting the support that they need. Support group participation can help individuals feel much less lonely, isolated, and judged as they're in a room and a shared space with individuals who are like-minded. There is a lot of resource sharing when in support groups. We allow time during our women's and men's support group to put out flyers for individuals to share, not just resources about their diagnosis, but also just general resources that they find in the community that they can share. Attending support groups allows for someone to have a sense of empowerment and control. They decided to come into a room and share of themselves and are there then also to support others. Support groups can help improve coping skills, leading to reductions in things like stress, depression, anxiety. And it can help individuals stay motivated to learn and participate in their care. So individuals that over time maybe get frustrated and tired of taking pills, but come and share that and get support, often have a better outcome for maintaining their care and maintaining their adherence to medications. In addition, the literature supports support groups. The American Journal of Psychiatry found that stress can turn HIV into AIDS faster. One study found that men with less social support, more social stressors, and who coped with being HIV positive by denying it had a higher level of cortisol and were more likely to develop AIDS than other HIV positive men. So that is just a really strong representation of what stress and holding on to things can do to our bodies. Generally, the Agency for Healthcare Research and Quality finds that adults without social supports have a 26% higher mortality rate, and that integrated social and medical services have a 10 times higher, more effective rate of improving health outcomes. So finding that support, being able to help individuals live longer and healthier lives. That's why we do support groups. In fact, in 2023, the Surgeon General declared loneliness to be a public health crisis. They likened loneliness to smoking 15 cigarettes a day. So almost a pack a day habit if individuals were experiencing loneliness. They found that increased loneliness increased chances of heart disease, stroke, anxiety, depression, even early death, as we talked about before. and made individuals 2.5 times more likely to develop problematic alcohol use. So long-standing health effects that loneliness can have on individuals. And I'm going to turn the stage over to Robbin for a few minutes. We're going to talk in a minute about our journey here at Sinai for our support groups and wellness programming. But Robbin was here before me, and Robbin got things started with what she referred to as a woman-to-woman forum for individuals who are HIV positive, women particularly, to share their stories. So Robbin, I'll give you the floor to talk about that for a minute.
Good morning, everyone. Hope everyone's having a great day. As Sarah said, I started the Woman to Woman Forum to support women who were newly diagnosed and long-term survivors, because I found that women who were able to share their stories and share their lives with other women were more likely to get a better outcome with living with their diagnosis. And so, as I began to do this years ago, we seen that women found that being able to support one another through the Woman to Woman forum, we saw an uptick of women participating in their care better than they were before, participating in sharing of themselves, participating in wanting to be involved in getting other women to get in and stay in care. And so, because of that, I decided that this was very important to continue having women involved with each other. And so it has been a success that has bloomed into other avenues of having our wellness programs, having our women to women group, monthly women to women support group, and women trusting each other. You know, folks beginning to trust that it's okay to talk about HIV diagnosis. It's okay to tell my doctor about other concerns I may have going on, because prior to that, women were not advocating for themselves about other health morbidities they were having. And so hearing it from other women allowed them to be able to feel comfortable talking to their doctors, talking to family, talking to anyone that gave them support. Now, that doesn't mean it was going to happen overnight, but because they had this form that they can utilize and see other women living as they were, and they felt comfortable to be able to do that. So, you know, being able to have that for these women was really, really awesome, because when we first started it, I think back in the late 80s, we may have had 10 women attend the Woman to Woman Forum. And as years went on, we were outgrowing locations that we were having it at. And so now, when we do have this forum for women that has also been able to include men, we see the outcome of the support. We see the outcome of the trust that people have been able to form, knowing, as Sarah said, this is a safe space. This is a space that we can come to and not feel judged, and not feel like what we share is going to come back and hurt us. It's going to allow us to help other people that are living with a challenge such as ourselves. And so the Woman to Woman Forum has been able to open many, many doors for not just women, but all people, because some of these women have been able to share with their husbands, with their spouses, with their nieces and nephews about the importance of what support means for them, what support means for others that we have been able to have here at Sinai Hospital. So I'm really proud that this woman to woman forum has opened many avenues for not just women, but other folks in the community, in the surrounding areas throughout Baltimore City, to help folks feel supported, loved, that they can live, that there's life after diagnosis with HIV. And just hearing the stories that we get every time we have a support group, every time we have a wellness event, of how this has helped them to cope and manage living with the diagnosis of HIV and AIDS. This has been a fulfillment of mine since beginning in this work, of being able to just see people thrive and live their best life, as it was stated in my bio, live their best life living with the diagnosis. And we will continue to do that as long as we show people that they can trust. That's major, that they feel the trust in what we are doing as a team to make the space available for women and men now to have and have support groups that they can come to, and knowing that whatever they share is safe here. Whatever they need is safe here. It's not when they go to their doctor's visits, it's safe. So support is not just about having a support group, but it's supporting them in living their lives. It's supporting them in every aspect of their lives. Support groups allows them to feel that, yes, we're going to get this, not just through a support group, but through everything we come to Sinai Hospital for. And they can take it to other places to feel comfortable about themselves and their diagnosis. Thank
you,
you.
Robin. Oh, sorry.
No, you're good.
I'm sorry. Were you done?
Sarah, yes.
Sorry. Thank you, Robin. Yes, that is like a wonderful synopsis of kind of the beginnings of where support groups came from within our program. Robin was running these support groups, these women to women forums, all by herself before we kind of branched off into providing overall psychosocial support. Excuse me. So for now, we're going to talk a bit about our journey here at Sinai Hospital for creating the programming that we have. As Ryan White's recipients, we have always had client advisory board meetings. They have gone from having 1 or 2 people show up to usually having 25 plus in a room. Our clients really love to come together and share information and give their feedback on services. And we are very lucky to have such an active and engaged client advisory board. In 2007, Robbin and I decided we were going to branch out from her woman to woman forum, which was offered a couple times a year, and try to offer a women's support group. And back at that time, we decided we were going to hold it in the lobby of the clinic because that was convenient and where it was. And our provider at the time actually bought pizza for the event. And Robbin and I spent an entire summer sitting together. We invited woman after woman that we worked with. We advertised, we put it out there on bulletin boards and shared all the information. And that first summer, it was Robbin and I. So if you're trying to get a support group off the ground, we'll talk. Sherri will talk in a while about perseverance. But please know that just doesn't happen overnight. We've spent years and years developing our support groups. Our women's support group, we do offer a monthly support group for women. And both Robbin and Sherri help moderate. And it has been such a phenomenal success. I wish I could give a time frame of the last how many years, but we typically have anywhere from our average is probably 10 or 15 women, but we probably have 30 plus women that participate throughout the year in our women's support group. We keep the women's support group very open, very much a talk support group. We do, of course, sometimes have providers come in and talk about different topics, and we'll talk a little bit more about that soon. But at one of our CAB meetings in 2016, we were coming together, and as I said earlier, we started having programming for men in 2010, and the men were saying, what are these ladies talking about, these support groups? They sound wonderful. We need to have support groups. They had a speaker come in, they did yoga. What's happening over there? And so the men got a support group. The very same month, April of 2016, we started our men's support group. I think it's probably fair to say it's harder to get men to come into a room and share of their intimate feelings. So we are very, very blessed for a couple of leaders that we have within our men's support group that are always helping others feel welcome, setting an example, and inviting others to join us in the group. And our men's support group is also flourishing. We probably have similar numbers to our men's support group as we do our women's support group for participation. Maybe on general, about 8 people participating, but a good list of probably 30 plus that come through at some point in time. These 2 support groups really were a springboard into our wellness programming, which we'll talk about next. We were very lucky to get some funding in September of 2016 to expand our programming because, as I said, our CAB was demanding more and more of, they wanted to have these meetings, they wanted to do all these things, they wanted to try different things. We had been bringing in kind of one-off providers to do things like yoga, to do things like journaling. And the feedback we got from clients is, this is needed. This is so supportive of us to help us learn coping skills to express ourselves in different ways. It allowed for some people to come into the group setting that had a harder time with talking and sharing, but being able to express themselves and learning to be comfortable in that setting. So we began our wellness programming in 2016, in addition to maintaining our women's and men's support group in their talking format. So a bit more about our wellness programming. We really, in the beginning, tried to focus on about 4 different areas, allowing individuals different ways of expressing themselves. So we tried to help individuals look at themselves and their well-being, not just about their diagnosis or even about their overall physical health, but we wanted to include physical activities to encourage people to move. Movement is so important in maintaining our health. So we had things such as yoga, Tai Chi, general movement. We've done dance. We've all done all sorts of dance. Reiki, which I don't know if would actually fall into the physical. I don't know where I would put that one. That was an interesting one with our clients. In addition, we have brought in lots of providers to help individuals with expressing themselves. So we've done journaling, we've done storytelling, we've done music therapy. In fact, our group that participated wrote and made a CD of a song that was just so impactful, and they were each able to take that CD home. We of course want to keep health understanding always in the mix, so we have things like nutrition and health coaching that we have incorporated. And then wanting individuals to have a way to do hands-on expression. If people weren't really able to do as much with the storytelling or journaling, perhaps it was hard for them to touch on those feelings or to share of those feelings. So we've had a lot of art therapy come through, and we've partnered with Art with a Heart numerous times to come in and provide art therapy for our clients. And every time they come, it's so impactful on just being able to have clients be able to express themselves in all kinds of different ways. And two of the things that we're most proud of is a quilt that was made and is hung in our office area, and a mosaic that was made that is actually displayed in our infectious disease ambulatory center. And this is a picture of the mosaic that was made. And as you can see, it's basically a tree and a nature scene. And our clients wanted to have a nature scene because they felt like that there's kind of a water going through the middle, that they felt like it was a soothing thing. They did a yin and the yang up in the corner there, and they wrote out the words love and hope, but not always in the most straightforward way, because that doesn't always come easily and straightforward. As you can see, there is a path and it begins out very rocky. And it's a demonstration of how a lot of people feel when they're first diagnosed with HIV. And then even though it continues to go uphill, it shows kind of a little bit smoother rocks as people begin to adjust, begin to understand, be able to cope with their diagnosis. And then it leads to someone climbing up a ladder, because getting to that last place where they truly accept the red ribbon up above, so they truly accept their HIV and their diagnosis as a part of their lives. That last little bit is sometimes a struggle and a climb. Which this is one of the most powerful depictions that I've seen when it comes to talking about HIV and how to cope with your diagnosis. And just FYI, I made the little flowers there because I wanted them to have something supportive and pretty along the way. That's just me. They throw in something pretty. So, continuing with our wellness programming, we had a major shift in our funding last year. And through the fantastic support that we always get from Hopkins, they helped us continue our programming. We, however, did a major shift this year and really wanted to concentrate and make a program that allowed for people to look at all aspects of their wellness. So we used the NIH Dimensions of Wellness, and each month had a different activity and presentation. We've covered things financial, intellectual, vocational, physical, of course, spiritual, environmental, social, and emotional. And so one of the things that we have really worked together on this year to be able to pull off this program, and this has been our most fantastic year of programming for the wellness program. We have had 15 to 25 people in a room each month to participate in this programming. That's huge when you're talking about getting people all in the room at the same time. And we involved all of our staff here within our HIV support services, helping to really do something different and innovative each month with one of these topics. So We've had individuals come in and talk about mental health from the agency. We had people come in and talk about vocational wellness. In addition, we have made vision boards and actually went to the Silburn Arboretum together for our environmental and talked about environmental wellness. So we really worked hard to develop a program this year that was very well received. And now I'm going to pass to Sherri Vishner Glazer. She's going to talk a bit about best practices and how we've instituted things over the years that we've learned. As again, I say, nobody's an expert from the beginning. So we learned lots of things along the way. She'll talk a little bit about our outcomes and perseverance before question and answer.
Thanks, Sarah. Hi, everybody. So yeah, it's been quite a journey that we've been on and figuring out lots of different things. And sometimes things come up in a meeting that catches and triggers us of like, oh, we should do that. So as many of us in Baltimore know, the community in Baltimore is very small. It's a large community, but it's a small community. People know each other. And we had a couple of events where somebody walked in the room, or we've several times actually, a client will walk in the room and see another client in the room and be like, oh, I know you. I went to school with you, or I went to school with your sibling, or I was a foster parent for your kids. We had that once. And that definitely encouraged us to have confidentiality agreements. Obviously, confidentiality only goes so far as people respect them. And in the years that we've been doing groups, it's been respected. Truly, what happens in the groups and in the rooms really does stay there. We've done a lot of encouraging with the clients and speaking with them, and yes, asking them to sign waivers saying that that they'll keep things in the room, whatever is shared. As Sarah mentioned as well. Sometimes the support groups can get really deep in what things are being shared, and clients can get really vulnerable and don't want that information being shared outside of the room. And we've really cultivated a culture of respecting that. And that goes for staffing as well as for clients. I mentioned the fostering. I think that happened with a vendor that we had brought in to do some teaching, and he saw a client in the room and realized, and he recused himself, that it wasn't appropriate for him to be with the group. We, as Sarah mentioned, we have a lot of clients who have come over the years, probably between 30 and 50 women, probably more over the years, participated, certainly close to that, certainly at least 30 to 40 men as well. And sometimes they come willingly and sometimes they need to be encouraged a little bit. We have over the years, depending on our funding situation and our energy levels, been able to provide meals, and we've definitely found there's been some success in having groups during mealtime and having meals available during that time. We've been able to do gift cards occasionally, and sometimes the incentives speak for themselves. Of, as Sarah mentioned, clients coming and being welcomed and being supported helps them come to their medical appointments, and it encourages their adherence to medications and adherence to their appointments, and allows the hospital to be a friendly place, a safe place to be, and not just a place where I get poked and prodded and reminded that I'm sick. We have tried all sorts of things, from bringing in speakers to come to our groups to having open forums where clients can just share what's on their mind. Sometimes that's talking about HIV. Sometimes it's talking about the most recent football game. There have been many months and years that I have sat through the men's group and they're just talking about football because that's what the guys want to talk about. But you do that enough times, and when something then comes up, the guys have formed a camaraderie that they can then share from a more vulnerable place. Just share a quick thing. One of our men is currently going through cancer treatment and came to a place where he was able to share that. And another of our men said, hey, I went through that several years ago and I'm on the other side. So even having those groups where it seems like they're just talking about silliness and why are we doing this and why are we here, still has those positive outcomes and support. Reminder calls are the bane of my existence sometimes. They take up so much time, but they pay off. Clients forget they've got a lot of things going on, and I think that's what we have to remind ourselves sometimes, that yes, these are all adults. Yes, they are functioning adults, and they have this chronic illness, and they often have these other things going on as well, and things fall to the wayside like everything else with, you know, all of us have that sometimes. So we'll make reminder calls. We send out calendars in the mail. We make reminder calls the week before. We make reminder calls the day before. We try splitting things up and having case managers call their own individual clients because they've got relationships with them. Sometimes we call them ourselves, Robbin and myself, because we have a relationship with them as the group leaders. We have offered groups different days of the week, different times of day. We found over time that Mondays and Fridays are generally not good days to do groups. Mondays because we can't get those reminders out, people forget over the weekend. Fridays because we and they are already ready for the weekend. So then we're like really focused on the middle of the week, but still different times of day. We even tried we offered, I think, for one rotation each, within kind of as a subgroup of the men's group and the women's group, we had a young women's group and a young men's group for some of our younger population. As Sarah mentioned, it's sometimes hard for a 19-year-old and a 60-year-old to be in the room and see like, what do we have what in common? And of course they do, because they've walked similar paths, but they're not in the same place. So and that actually allowed some of our younger clients to get used to that format, and then we're able to and have continued to come to our more general larger groups. And then the evaluations at the end, we try, you know, we maybe twice a year we try to have evaluations put out to ask clients what's working well, what's working less well, and ask really specifics. And some of the outcomes that Sarah was able to speak to, or that we're speaking to now, like that we've gotten directly from, that we know that the clients have increased their adherence to their medications and their adherence to their medical appointments, because they've told us so on these evaluations, that it is a direct result to talking with other clients who are HIV positive, to showing up and seeing the hospital as a place that's not just about their medication and just about their sickness, or the disease that they have, or, you know, any of those things. It speaks to them, you know, just the social outcomes of increasing their overall well-being, decreasing their depression and their anxiety, increasing their sociability, feeling less isolated, and even learning things that they can take home. Some of the art projects that we've done, they take home with them. Some of the gardening projects we've done, they take home with them. The music CD that we created, they took home with them. And it's not even just a matter of what we're doing here in the space, but what they're then taking away to their everyday space. Because some of them we see every day. Most of them we see, you know, a couple times a month. And it speaks for themselves, this slide, 90% feeling that they're achieving their goals, they're impacting their adherence, they're feeling more positively connected, they're feeling less down, less isolated, and learning skills. And we're seeing those outcomes year after year, every time we do the evaluation. Different classes, different activities, different clients, and the outcomes are showing positive every time. I've already touched on some of this, but around the perseverance, just throwing things at the dart and seeing what sticks. You know, it really is trying different things. And of course, going back to the CAB meetings that we still do a couple of times a year, and asking for feedback, asking for suggestions. We have switched gears a few times to doing, you know, our wellness classes. We started out 4 times a month, and then we went down to 3 times a month. And now we're doing them once a month, and we're getting a lot more people coming. Because, you know, for who knows why, right? We can imagine why. People are busy, and there's other places doing groups as well, and we're trying not to compete with them because there's no reason to compete with them. Bringing in different speakers, giving clients an opportunity to facilitate the group, trying all those different scheduling things, making the reminder calls, all of it. And I'll just speak a little bit also, you know, the reminder calls, and sometimes, you know, sometimes we'll have a group and 2 people show up, even now, even, you know, 10 years later, 15 years later, 20 years later, the weather might be beautiful out and nobody comes. The weather might be terrible out and 10 people come or nobody comes. We have a couple of times last minute decided to cancel a group because we're just realizing that people aren't going to come and better to just regroup. And Sarah and Robbin and myself and our other colleagues, we will sometimes just, yeah, last night didn't go really well, or the group that we just had, like we had 20 people RSVP and 5 people showed up, and we ordered food for 20 people and 5 people showed up, and there went our money for our budget. But we keep doing it because we're seeing these outcomes, and the clients are so, so grateful when they do come and they're participating and they're encouraging. And I'll share one more little anecdote. I started out here as a student intern, and I remember still going to those women's groups, I don't know, 15 years ago, more, and just seeing the women supporting each other, the women who seemingly had it all together. They were good, their HIV was under control, it seemed like their lives were under control, and they were coming back month after month, time after time, to support the next generation coming through. And for sure they were benefiting as well, but what I saw as, you know, a 20-something-year-old student was that they were coming to support the next round. And that was so powerful and motivating for me, that I wanted to come back and keep giving back to it. Questions?
Yes. We are up to our questions. I don't know if there was anything in the chat or if anyone just wants to ask us something.
Yeah, so I mean, I think first, thank you so much for what you do. I think I was blown away just by knowing what you guys do, but to just see the history and also talking about the failures, right? I think sometimes it's so important to say, you know, you have to, there are growing pains in developing a support group, and I think people needed to hear that. We certainly have tried and have had times when we had 2 people there or no people there, and you have to be persistent. And just to see the outcomes too, the actual objective data to say that there's impact. I don't see any hands up yet, but please do feel free to raise your hand and unmute you if you do. I do have a comment and a question. I guess the comment was, I was struck by the stat you put that loneliness equals 15 cigarettes per day, which is greater than a half a pack a day of cigarettes, which we know has significant impacts on comorbidities, hypertension, diabetes, you know, heart disease, and the like, particularly in this current MAHA, Make America Healthy Again. And I think it's really interesting to see that actually supporting these kinds of things, the psychosocial support beyond the ART and the medical care, is critically important. And sometimes the first things that get cut because it's not thought about as important. And so just really love that you put that in perspective to say that we can't afford to lose that piece because it's just as important as smoking cessation or ART. So thank you for that. My question was around format. And I'm going to get you to brag a little bit about how, you know, virtual versus in-person. Nowadays, so many things happen online. And I think even though people are more connected than ever, they're more lonely than ever. And so I'm wondering if you can comment on your experiences with in-person versus virtual and any advice either way. And then others, please weigh in.
So we definitely, during COVID, wanted to keep our support groups going. That was like vital to me to make sure that we were maintaining connectivity with our clients, not just ourselves, but them to each other during that time where things were just so weird and up in the air and we didn't know what was going on. So we did switch to virtual, and we did have success with that. not as many people always coming on. A lot of our older clients didn't have the ability or understand the ability of how to get on. But we did, of course, want to continue that. But as soon as we could, we got back to in person. And we have not gone back to providing online. The in person is just it's just that feeling of being together, of that shared experience that is much harder to do. And I'm a big advocate for online therapy. If you can't get in person, do it, please. Same with support groups. If somebody can't, please join an online support group. But because our clients do come to the clinic, which is right across the hall from us, we've really kept it in person. And we really feel like a lot of the success, both in getting people together, as well as the outcomes, the power for outcomes, we feel like that comes from being in person together. And that's hard. Sometimes it might be weather dependent. It's too hot, it's too cold. We can never predict. You can have, like I said, a beautiful day and nobody shows up. And one time it snowed and we had like 20 people show up. I was like, I almost didn't show up. What are you doing here? But you just power through.
No, that's great. It's almost 1 o'clock. We have 1 minute. So I'm going to throw it out. Anybody have any last minute questions before I close it out? Oh, there is one. It's from Marina's. How long did it take until you felt like you had established a support group? And it's a question from Caitlin Rieger, who's in our program.
I mean, probably a couple of years till we really felt established. Like I said, Robbin and I spent an entire summer eating pizza together. Our provider at the clinic kept buying pizza. We're like, Joanne, nobody's there except me and Robbin. She's like, it's fine. She was donating it. And so, but we spent a lot of quality time, Robbin and I, talking about, well, how do we do this better? How do we get somebody else in the room besides you and I? Because we see women who want this and ask for this, but how do we get that initial in the room? It takes a lot of work. It takes a lot of, like we said, persistence. Just reminding women again and again. I still have women that haven't shown up, and I've worked here for almost 19 years. Some of them never shown up, and I still say, hey, don't forget. We have these programs, and don't forget, we even have groups where you don't have to talk very much. You can come and you could do yoga, and that's gotten a couple people in the room that would never have started to come in a room to speak.
So Sarah, it's 1 o'clock, so now we have to end. I do have one quick question because I said engage, amplify, but also leverage. Are your support groups and some of your wellness programming only limited to people that are seen at your center? Or if someone had a person that wanted to come over, could they do that? Maybe you could speak a little bit about that.
Yep. Absolutely. We take referrals from anyone. We have clients that refer other clients, and we just ask that they, of course, bring in the Rye and White documents. We'll explain what that means to them, but we are always open to referrals. We have flyers. We do try to share them on listservs, but anyone could just reach out to myself, Robbin, or Sherri, and we'll be more than glad to set a person up to come.
If you could drop that contact information in the chat, because I can imagine that there are quite a few people who may want to do that. We had a lot of interest in this toolkit. So people oftentimes will sign up, whether they can attend or not, because they know they'll get the slides. And I'm sure you're going to get some people DMing you, for those people who don't know, direct messaging, DMing you to ask some, about how to do this, but also maybe even to take advantage of your programming. Guys, thank you so much. This was amazing. I learned a lot, and I'm incredibly proud to be in partnership with you and what you were doing for the community and also for yourselves. There's a lot of smiles and positive energy we felt from you guys as well. Clearly, the support group facilitators feel the support and the love as well. Thank you.
We couldn't do this without your partnership, so thank you.
No, thank you. It is an absolute pleasure to be in partnership. Everybody, thank you for your attention. If you're signed up, you'll be getting a link to an evaluation. Please complete that. You can see it if you want to hear it again, and the presentation will send out as well, but also it will be forever on our YouTube channel to weigh in. Marina, any last words before we sign off?
No, I just want to say thank you to Sarah, Robbin, and Sherri. I really do appreciate working with you guys in your partnership and seeing the how the support group and all of the other groups have developed over time has really been a joy for me.
All right, guys,
Thank
take care,
you.
stay cool, and we'll see you next time.
Thank you, everybody.
Thank you. Bye-bye.
Bye-bye.